So let's continue that theme, reducing loneliness during a pandemic. Joining us now, Dr. Jackie Kinley, a psychiatrist who also teaches at Dalhousie University's Medical School in Halifax, and Riaz Medji. He was a broadcaster and now the author of the new book, Every Conversation Counts, where he helps people overcome loneliness and build deeper relationships with others. Thanks to both of you for being here. And Dr. Kinley, first to you, your reaction to that story.
Well, first of all, I was just saying, I find just Myrtle's story is very touching. She's kind, she's caring. You can really feel she wants to attach, and I don't think her story is a sort of singular one. It really speaks to the hunger of the number of people that want to sign up for this program, which is so fabulous, and how it bridges those differences. We make assumptions about other people, appearances, sort of at face level. Just the conversation about the genes, and I just thought it was so touching. I mean, I think. Giving folks an opportunity to recognize that they're more similar than they are different, and we all need the connection. We need the warmth. We need the belonging. I just thought it was a beautiful story.
Yeah, and of course, loneliness is not just something that seniors are dealing with. I want to play a couple of clips from some younger viewers, what they had to say.
It's just become increasingly difficult to distract myself from how lonely I am. When it comes down to like a day or a week, that's easy. But when you're talking about months or maybe longer than that, it just wears on you.
I am typically somebody who loves staying home, but this year has certainly been a different experience.
I miss connecting with people in real life. I live alone, and I'm experiencing a new university program studying virtually from home.
Video chats are a really good substitute, but they're no replacement for the actual live connection.
Riaz, you've been helping people overcome loneliness before the pandemic, but since it began, how have things changed?
I'm really glad you brought in, Ian, the younger demographic and the focus here. I mean, the health research firm Cigna focused on the fact Generation Z, age 18 to 23, is the loneliest generation in America. And there's this great paradox with loneliness that many of us can experience it, yet many of us experience it alone because we feel shame. We feel embarrassment, and it's so important. If there's one silver lining of the pandemic, it's being open with this vulnerability, that we're feeling it, so then we can find ways to work through it.
Dr. Kinley, I see you nodding through all of that. Why don't you jump in?
Well, I think that sort of this generation, I think it's so true, is that connecting with other people is paramount for them. They learn through their peers, they connect, they grow. It's not just the physical, it's the emotional energy that nurtures us, right? And so I think this generation in particular, it's a generation of hope. They're young, they want to connect, they want to reach out. And I think a lot of them feel ripped off. I not only hear the anger and the frustration, I feel the sadness and the fear. And I think this generation has, first, even before COVID, the environmental angst and all of the things that they were feeling, this is very, very difficult for them.
A big question to both of you, and I'm only going to give you each a minute to answer it. Riaz, I'll begin with you. Advice for people who may be watching this at home, feeling lonely, wondering how they can address it.
Two things that stand out. One, if we're using technology, creation over consumption. How we can use technology to create more face-to-face instead of passively eavesdropping or mindless scrolling on social media feeds that can alienate us or lead to a sense of inadequacy. And if we're creating that face-to-face, and right now we rely on video, this will amplify the level of emotion. That's what we need now, these emotional check-ins of what are you grateful for? What's the experience that taught you something this week? What are you looking forward to? These are the types of check-ins that are going to help lift people up.
Dr. Kinley?
Well, I guess I would also say that it's not just about connecting with others, but it's about connecting with oneself. And I really do think that we sort of live in a generation where we've lost touch with ourselves, with our kind of moral compass and our purpose and all kinds of things. And the capacity to be alone is the capacity to be with oneself. And, Riaz spoke to shame. I think there's so much. Am I not worthy? Why don't people want to? What's the future going to be like? I think people get caught in these traps. And I think kindness, compassion, not just to others, but to oneself, is so important, getting to know oneself.
And Dr. Kinley, what about the connection between loneliness and mental health? What are you seeing?
Well, you know what? It's not the cutoff, I think, that is the issue. It's not the loneliness, it's the reaction to it. So loneliness in and of itself makes one feel empty and sort of lost. But it's when people get angry, when people get scared, when people get sad. The anger is the suspiciousness and all of that kind of stuff. The fear leads to anxiety, and the sadness leads to depression. It's not being able to deal with the emotions that are associated with the loneliness that causes the difficulty. So it's the emotional capacity. People are having a trouble grieving. They're having a trouble working through their feelings. And that's why we're having so much difficulty. Loneliness in and of itself is one thing. It shouldn't necessarily drive symptoms. The fact we're seeing symptoms is because people can't deal with the emotions that are coming as a result of feeling cut off.
Well, really nice talking to both of you. And I should say, before we did the interview, Dr. Kinley said she read Riaz's book just yesterday, Every Conversation Counts, and gave it 2 thumbs up. So that's a pretty good endorsement. Thanks to both of you.
It's very
Thanks,
good.
Doctor. I'll take that.
Thanks. It's nice to meet you.
You as well.